Welcome. My name is Washonda Jones, and we will be discussing word structure for ME1160 and the female reproductive system. ME1160 reproductive system for the female. Let's first take a look at the functions of the female reproductive system. It is for the creation and support of new life. The female has ovaries, which produce mature eggs to be fertilized by sperm. There's also a uterus that provides environment and support for the developing child. And a female also has breasts that produce milk to feed the infant. Structures of the female reproductive system. You have the external female genitalia, and they're located posterior to the mons pubis. Structures collectively are known as the vulva. You have your labia majora, labia minora, and they protect the external genitalia and urethral meatus. You have the clitoris, which is the erectile tissue. You have Bartholin's glands, which lubricate the vagina orifice. And then you have the vagina orifice, which is the exterior opening of the vagina, partially covered by the hymen. Next, you have your breasts, and they're made of fat connective tissue and mammary glands. The mammary glands are milk-producing glands that develop during puberty. They are lactiferous ducts, and they carry milk from the mammary glands to the nipple. We see here that lac means milk, and ephorus means carrying or producing. And then you have the areola, the dark pigmented area surrounding the nipple. For our internal female genitalia, these are located within the pelvic cavity and protected by bony pelvis. You have two ovaries. They're small almond-shaped organs located in the lower abdomen on either side of the uterus. The follicle is a fluid-filled sac containing a single ovum, and the oval is the female gametes or eggs. Next, you have two fallopian tubes. They extend from the upper end of the uterus to the point near but not attached to an ovary. They carry sperm upward from the uterus toward descending mature ovum to allow fertilization. Infundibulum is the funnel-shaped opening into the fallopian tube near the ovary. And then you have your fimbriae. This is a finger-like extension that catch the mature ovum when it leaves the ovary. And then we have our uterus. And this is a pear-shaped organ with muscular walls and mucosa membrane lining. It's located between the urinary bladder and the rectum. And the normal position is antiflexium. We see here that anti means forward and flex means to bend. Your parts of your uterus, you have a fundus, which is the rounded part above the entrance of the fallopian tube. And then you have the corpus, which is the middle portion, body of the uterus. And then the cervix, which is the lower narrow portion that extends into the vagina. And then you have three major tissue layers, which include the perimetrium, which is the outer layer, the myometrium, which is the muscular middle layer, and then the endometrium, which is the inner layer rich in blood vessels. And then we have our vagina, which is the muscular tube extending from the cervix to the outside of the body and lined with mucosa. Let's next discuss the process of menstruation. This is a normal periodic discharge of endometrial lining and unfertilized egg from the uterus. The menarche is the beginning of menstruation. The average age in the United States is 12 years. Men means menstruation and arche means beginning. Next, we have menopause, and this is the normal termination of menstruation during middle age. Consider confirming you had a menstrual period for 1 year. Perimenopause is the transition phase between regular menstrual periods and no periods at all. Terms related to pregnancy and childbirth. Ovulation is the release of mature egg from the follicle. It occurs on approximately the 13th or 14th day of the menstrual cycle. The corpus luteum secretes progesterone during the second half of your menstrual cycle to maintain growth of the uterine lining in preparation for the fertilized egg. If no fertilization takes place, the endometrium sloughs off. Fertilization, which is when conception occurs, when sperm penetrates the fertilized ovum, union forms a single cell known as a zygote. Implantation is embedding of the zygote into the uterine lining. The embryo is from the implantation to the 8th week of pregnancy. Fetus is from the 9th week of pregnancy to the time of birth. Fet means unborn child. You also have terms that refer to multiple births. For fraternal twins, that is the fertilization of a separate ova by separate sperm cells resulting in 2 separate embryos. And then you have identical twins. This is fertilization of single ova by single sperm that divides to form 2 embryos. Each twin has the exact same genetic information from the parents. Some other terms to be familiar with: chorion, which is the outer membrane that encloses the embryo, and it contributes to the formation of the placenta. And the placenta is the temporary organ within the uterus allowing exchange of nutrients, oxygen, and waste products between the mother and fetus without allowing mixing of maternal blood and fetal blood. You also have the amniotic sac, which is the innermost membrane that surrounds the embryo in the uterus. Amniotic fluid protects the fetus and allows for the floating movements. The umbilical cord carries blood, oxygen, and nutrients from the placenta to the developing baby. It also transports waste from the fetus for disposal through the mother's excretory system. The cord is cut soon after delivery of the baby, but before the delivery of the placenta. Next, let's look at some terms of gestation. The period of development in the uterus is known as gestation. The average time is approximately 280 days, 40 weeks, divided into 3 trimesters. The due date is calculated from the first day of the last menstrual period. Quickening is the first fetal movement felt by the mother. Braxton Hicks contractions are intermittent, painless contractions occurring frequently as pregnancy progresses. Viable is when the fetus is capable of living outside of the uterus. Antepartum is the final stage of pregnancy just before the onset of labor. Let's review some terms surrounding the mother. Nulli gravida is a woman who has never been pregnant. Nulli is none and gravida is pregnant. Nullipara is a woman who has never born a viable child. Para means bringing forth. Prima gravida is a woman during her first pregnancy. Prima means first. Primipara is a woman who is giving birth to a viable child the first time. Multifarious is a woman who has given birth 2 or more times. Parous, having born 1 or more children. Now let's look at some terms around childbirth. Labor and delivery is the parturition. There are 3 stages: dilation, delivery of the baby, and expulsion of the afterbirth. The first stage is the longest stage. This includes gradual dilation and effacement of the cervix and rupture of the amniotic sac. Fetal monitoring records, fetal heart rate, and maternal uterine contractions during labor. The second stage begins when the cervix is dilated 10 centimeters and is completed at the delivery of the baby. The third stage is the expulsion of the placenta or afterbirth. Postpartum means after childbirth. Puerperium is the time from delivery of placenta to approximately the first 6 weeks. Lochia is postpartum vaginal discharge that continues 4 to 6 weeks after childbirth. Loch means childbirth. Uterine involution is the return of the uterus to normal size or condition. Colostrum is a specialized form of breast milk that delivers essential nutrients, antibodies, to the newborn. It is produced during late pregnancy and the first few days after giving birth. Lactation is the process of forming and secreting milk from breasts. Milk develops a few days after giving birth and replaces the colostrum. Postpartum depression are feelings of sadness and loss of pleasure in normal activities occurring shortly after giving birth. Now let's look at some terms about the baby. A neonate is a newborn infant during the first 4 weeks after birth. Vernix is the greasy substance that protects the fetus in utero and may be present at birth. Meconium is the greenish material collecting in the intestine of the fetus, forming the first stool of the newborn. APGAR scores are a scale of 1 to 10 that evaluates newborns' physical status at 1 minute and 5 minutes after birth. The best score is 8 to 10. It's graded on 5 criteria on a scale of 0, 1, or 2. They look at the heart rate, respiratory effort, muscle tone, response to stimulation, and skin color. Now let's review some medical specialists regarding female reproductive systems. A gynecologist specializes in diagnosing and treating diseases and disorders of the female reproductive system. Gynec means female. An obstetrician specializes in medical care during pregnancy, childbirth, and immediate postpartum. A neonatologist specializes in diagnosing and treating disorders of the newborn. Neo means new and nat means born. Infertility specialists can diagnose and treat problems associated with the conception and maintaining of pregnancy. Now let's look at some pathologies of the female reproductive system. Ovaries, fallopian tubes, and ovulation. Anovulation is absence of ovulation when normally expected. Menstruation may continue. Oophoitis is inflammation of your ovary. Oophore means ovary. Ovaries, fallopian tubes, and ovulation. Ovarian cancer. This is cancer originating within the cells of the ovaries. Pelvic inflammatory disease. Inflammation of female reproductive organs occurring frequently as a complication of STDs or sexually transmitted diseases. Polycystic ovary syndrome is ovarian cysts resulting from incompletely developed follicles. Pyosalpinx is accumulation of pus in the fallopian tubes. Salpinx means fallopian tube. Salpingitis is inflammation of the fallopian tubes. Salping means fallopian tube as well. The uterus. Endometriosis is patches of endometrial tissue which escapes the uterus and attached to the other structures in the pelvic cavity. Metri means uterus. Endometrial cancer is cancerous growth that begins in a uterine lining. Uterine fibroids are a benign tumor composed of muscle and fibrous tissue and occurs in the wall of the uterus. Uterine prolapse Its uterus slides from the normal position and sags in the vagina. Your cervix. You can have conditions associated with cervix, cervical cancer, which is a slow-growing squamous cell cancer, cervical dysplasia, which is the presence of precancerous changes in cells that make up the inner lining of the cervix. Cervitis, which is inflammation of the cervix. Cervic equals cervix. Endocervitis is inflammation of the mucous membrane lining the cervix. Conditions associated with the vagina. Coparexis is tearing or laceration of the vaginal wall. Co means vagina. Dyspareunia is painful sexual intercourse. Pareunia equals sexual intercourse. Leukorrhea is whitish mucus discharge from the uterus and vagina. Another condition associated with the vagina is vaginal atrophy. This is decrease in elasticity and lubrication related to hormonal changes. Vaginal candidiasis is yeast-like infection of the vagina. Vaginismus is involuntary spasm of the pelvic floor muscles. Isthmus means spasm or contraction. Now let's look at the external genitalia. Pruritus vulvae is severe itching of external female genitalia. Vulvodynia is painful syndrome of unknown cause. Vulvi means vulvae, and dynia means pain. Vulvitis is inflammation of the vulva. Now let's look at some conditions associated with the breast. Fibroadenomia is firm mass rising from the excess growth of glandular and connective tissue in breast. Fibrocystic breast disease is single or multiple benign cysts in the breast. Galactorrhea is production of breast milk in a woman who is not breastfeeding. Galacto again means milk. Mastalgia is pain in the breast. Mastitis is infection in the breast, frequently seen during breastfeeding. Amenorrhea is abnormal absence of menstrual periods for 90 days or more. Dysmenorrhea is painful uterine cramps during menstrual period. Dysfunctional uterine bleeding is abnormal bleeding due to hormonal level changes. Other menstrual disorders, hypermenorrhea, which is excessive menstrual flow for more than 7 days. Hypomenorrhea is usually small amount of menstrual flow. Menorrhagia is excessive uterine bleeding during your menstrual periods and at other irregular intervals. Metro means uterus. Menorrhagia is uterine bleeding between menstrual periods. Oligomenorrhea is infrequent or very light menstrual periods after previously normal periods. Polymenorrhea is menstrual cycles occurring more frequently than normal. Premature menopause. Ovaries cease functioning before the age of 40 due to disease, hormonal disorder, or surgical removal of ovaries. Premenstrual syndrome are symptoms such as bloating and headaches occurring during the 2 weeks before menstruation. Premenstrual dysphoric disorder is emotional and physical problems closely linked to your menstrual cycle. Now let's look at terms associated with pregnancy. Abortion is interruption or termination of pregnancy before the fetus is viable. Ectopic pregnancy is implantation of the egg outside of the uterus. Infertility is the inability of a couple to achieve pregnancy after 1 year of regular, unprotected intercourse. Preeclampsia is complication of pregnancy characterized by hypertension, edema, and proteinuria. Eclampsia is a more serious form of preeclampsia leading to convulsions and/or a coma. Elevated liver enzymes and low platelet count syndrome. This can be a life-threatening pregnancy complication. It is characterized by hemolysis, elevated liver enzymes, and low platelet count. It can occur during the 3rd trimester of pregnancy or after delivery. The Rh factor defines the presence or absence of the Ra antigen on red blood cells. Can cause difficulties when Rh negative mother is pregnant with Rh positive baby. Now let's look at terms associated with childbirth. Abruptio placenta. This is when the placenta separates from the uterine wall before the birth of the fetus. Breech presentation. Buttocks or feet are positioned to enter the birth canal first instead of the head. Placenta previa. Implantation of the placenta in lower portion of the uterus. Premature infant. The fetus is born before the 37th week of gestation. Stillborn. This is the birth of fetus that has died before or during delivery. Thank you for listening to the presentation on word parts and structure for the female reproductive system in ME1160.